Today's video is about Legionnaire's disease. This is something that I think a lot of people have heard of, but they might not know the details of it. So Legionnaire's disease was first described in 1976 after a very classic outbreak that occurred at the Bellevue Stratford Hotel during the American Legion Convention in 1976. And this was a very severe pneumonia that impacted these veterans and killed several of them. And a new pathogen was discovered. However, looking backwards, we find that Legionnaire's outbreaks occurred before that. One of the things that's interesting about Legionnaire's disease, so it's caused by a bacteria called Legionella pneumophilia. It is a bacteria that lives in water. It usually interacts with amoeba, but it's really a disease of industrial civilization, because where do humans get it from? They often get it from exposure to water from cooling towers. So for example, if you walk through a city, you might see cooling towers on top of apartment buildings. Those can get contaminated if they're not maintained appropriately, if water temperatures go high. This has happened in nursing home water containment facilities as well, and caused major outbreaks in nursing homes. It's happened in hospitals as well. So industrial water that might be supplying air conditioning, that might be supplying the water that comes out of your faucets, that can get contaminated. People inhale it, and some people just get a flu-like illness, but some people get a severe pneumonia. It's not something that transmits from person to person, so it's not contagious. And it's not something that you can diagnose routinely. It's a hard organism to grow. You need special types of petri dishes. So we do send special tests. Sometimes we actually test people's urine to look for one of the antigens for the most common type of the bacteria. And it usually will respond to antibiotics, but not always the standard, penicillin type antibiotics. You have to give a special type of antibiotic, something like azithromycin, which people know about as a Z-Pak, or a fluoroquinolone like levofloxacin or levaquin. You have to give a special antibiotic, and it can be quite severe, and it does tend to prey on people with underlying illnesses, older, smokers, alcoholics, and you can get it in travel settings as well. Anywhere that there's contained water that hasn't been maintained appropriately and you're inhaling it because it's misting from an air conditioning vent or whatever it might be. So travel is a risk factor because of the air conditioning units that you're exposed to. But it is a very common infectious disease, but underappreciated, and it is really common in Western Pennsylvania where I practice.